My name is Cheryl Murphy, and I'm going to be presenting today initiation of an HSP lab work at triage using an algorithm. First of all, we know how crazy the emergency department can be. Right now, you look outside and we've got ambulances in the driveway bringing patients in. The lobby's full. All the rooms in the back are full. There's nowhere to put anyone. So we have to ask ourselves, well, what do we do with patients who walk in who are presenting with acute coronary syndrome? Because those are patients who are, a big concern to us. So the first thing they do is they register in with the registration clerk. The registration clerk will alert the triage nurse that she's got a patient out there with chest pain. So that's our step one. The triage nurse is going to determine, do I have a treatment room available? Well, if I do, then the first thing I'm going to do is take the patient straight back to a room by wheelchair, perform an EKG, and alert the physician. If I don't have a room available, the EKG tech at triage will perform an EKG. The next step will be to take the EKG to the ER physician and let him review it. At that point, he will determine if the patient's safe to wait in the lobby or if they need to come back, find a room somewhere in the hall or whatever, and get the patient back. So the physician determines that the EKG is okay, doesn't show anything acute, and the patient can safely wait. So what we're going to do next is have the tech or the triage nurse, whichever one's available at that time, take the patient to the drawing station, start a saline lock, and draw a rainbow of blood so that we can send to lab and initiate orders. When the physician decides that needs to be done, he will put the order in the computer at that time for the lab work. After that, we'll let the patient know the process and that they're okay. The doctor has determined that he's okay to return to the waiting room and wait until a room is available. So that's our basic algorithm. As we all know, an algorithm is just complex process broken down into simple yes or no steps. So, and this is a fairly simple step. So what we're going to do is just go over it again real quick. They can only be instituted when there aren't any rooms available. We'll perform an EKG along with the previous EKG if they have one here. Let the ER physician review the EKG and anticipate ordering lab work. We're going to explain this procedure to the patient, start a saline lock and draw a rainbow. We're going to take the blood obviously to the lab, order the panel in the computer, and then we're going to have the patient go back to the waiting room. And then again, we'll place the patient in the room once one becomes available. So we're going to see how well our triage nurses understand the process. So I'm going to ask two of my seasoned triage nurses to come up and put together the algorithm.
Okay, so the first step is that the patient presents to triage with ACS symptoms, and this is going to be done on patients that are 35 years and older.
Then it comes down, is there a treatment room available?
So in the first case, yes, there is a treatment room available, and so we just put our patient back there and alert our physician that the patient's in the room.
If there's no treatment room available, what we're going to do is perform an EKG on the patient in triage.
That EKG will then be immediately taken to our ER physician for review.
The physician will review the EKG and tell the nurse that the patient can safely wait out in the waiting room. Well, then there'll be, we'll draw a blood specimen for the cardiac profile, start a saline lock, and order the HSP.
And then after the blood has been drawn, our patient will return to the waiting room and wait for the next available room, or pending that the lab calls back with any critical troponins, in which case we would alert the physician and take them back to a room immediately. And that's
Very good. So we can see that our two experienced triage nurses understand the process. And that is my teaching and learning strategy for the emergency department. Thank you. Anybody have any questions?
No.
Thank you.